Okay, so in this video we are going to discuss further the interpretation and the way of navigating through the CBCT. As we said, we are using here the Sorona Galileous machine, and the software is Galaxies for the 3D rendering. We've opened the same X-ray we've seen in the last video, and as usual it will open in the exact center. And I would prefer is that if you don't have any previous idea about your patient, I would prefer that instead of going through the panoramic view to have a general look for the patient, I would prefer that we would go through the axial view. In the axial view, the axial view in fact gives you the chance to navigate through the different layers in a cross-cut section, so that, see, if you go to the, like for the sagittal plane, you will have only one section, okay, mediolaterally. If you go through the coronal, then you will have one section which is the anterior-posteriorly. But if you go into the axial view, then you will have the chance to navigate or to examine the area from the lateral to lateral, passing through the medial areas, and then you will have also the chance to navigate through from the anterior to the posterior of the patient, as well as you're going through the different layers in an anterior-posterior direction, so you will not miss it. You will not, hopefully you will not miss you will not miss anything, and at the same time you will have the whole image being seen at a single view. Mind you that, as you can see in here, the cone beam can only cover from the frontal. I will just put it here in the volumetric mode, sorry, in the surface mode. It will only show the patient or the view in from the frontal sinus, okay, from the frontal sinus downwards to the chin of the patient, as you can see in here. And this is the maximum coverage of this X-ray. This is the vertebral column, okay. So you will see it all. Okay, let's go back to the axial view for this patient. I will just maximize it so that we will have an idea, and I will try to put it here so that we will have the maximum coverage over here. Okay, I will go through I'm going up, and this is the maximum that this image will show. You see here that there will be no image at all. And if we go back to the main window, see, we have gone. This is where we are. This is the section, and this is where we are here, up over here. So there are no more tissues. Now if I go down, see where I'm going? Down, 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 and then the image is gone, because I have gone to the maximum limit of the X-ray. Remember, if you go back to the lecture of the cone beam CT, we said this is controlled by the cone, which exposes the patient's head in a single rotation. Anyways, so if we go back again to the exact center, this is the incisor foramen, as you can see here in the coronal view. I will just maximize this so that we will get orientation, because it needs a bit of imagination so that you can know what we're going through. Okay. Let's have a reference here. Our reference here is the, can you see this? I will just drag this away. Of course, when I have dragged this away, see the whole section now has changed. See what's going on? So I'll just put this away, because I cannot, unlike here, the crosshair can be removed, but in the axial it cannot be removed, so it stay on the way. So I'll just put it away, slide it away, so that it will not cover the X-ray. This structure over here is actually the bite block. This is where the patient is going to bite. Here is the point of interaction between the maxilla and the mandible. Okay. Let me start from the mandible, and then I will go upwards. So there is no image here. Then I'm going up. You see that structures started to appear, and the first thing that will appear is the hyoid bone over here. Then I will go up. There are some structures that will start to show. These are the submandibular glands. Of course, we cannot differentiate between the submandibular and the sublingual glands here, because they will all appear gray at the end. This is unlike CT. Even if you go to the whatever mode you can tickle here, you cannot differentiate. Anyways, I'm going up, and this is the inferior border of the mandible, which started to show. This is the hyoid bone, and part of the soft tissues will start to appear. Okay, I'm going up. Part of the tongue is starting to show over here, and these are the sublingual glands, and this is the oropharynx, because this is air-filled cavity, so you cannot see it, it appears completely radio opaque. I'm going up now. You can see that the hyoid bone is started to show more apparent, and these are the posterior horn of the hyoid bone. Okay, I'm going up. See these two extensions extending backwards. These are the genial tubercles, and this is the lingual pit or the lingual foramen. I'm going up. The hyoid bone started to disappear, to be replaced completely by the tongue, because we have gone through. We are now above the level of the hyoid bone. This is the hyoid, by the way, hyoid bone over here. So it started to. We're going above the level of the hyoid bone. Now I will go up again, and as you can see here, that these are the posterior bones of the hyoid, and we started to see the atlas vertebra over here. Tongue, and we're still here starting to go into the level of the still in the submandibular glands. Can you see her over here? This is the mental foramen on the left side. By the way, this is the left side, this is the right side of the patient. You can see it over here. I will go up, and the mental foramen, they are not necessarily at the same level always. So this is the mental foramen, and this is the mental foramen on the other side. I will go up. See, we are starting to see here the inferior dental canal, and this is the exit. I'll go back again if you see. So the mental foramen actually differs in its position. Okay, I'm going up. This is the lingual plate of the mandible, and this is the palatal plate. See the difference between the compact bone and the spongy bone, which forms the medullary part of the mandible. I'm going up. and we started to see here the apex of the canines, lower canines being the longest teeth, and I will go up. I'm starting to go up now. Apices of teeth started to show. Okay, I'm going up, and now we're starting to see the teeth. See, now here I cannot differentiate between the cheek, the lip, and the tongue. All appear the same radio opacity. Atlas vertebrae is very clear here, and the oropharynx is very clear. It always remains radiolucent. I'm going up now. See, we've started to go into the level of the teeth. As you can see here, this is the central lateral canine. See the pulp canal 4, 5, 6, which has a mesiolingual, distolingual, and a distal root. Let us see if this tooth has two canals. A single canal. This is the 7, and again you can see it over here. This is the 5, the 6, the 7. 8s are not present, and we are going now into the level of the pulp horns, and then we will go up. We're going up now. We're going up, and we are beyond the level of the teeth. Now we're starting to have here the mandibular foramen on either side, which is the start of the lingual canal, inframandibular canal. Now after this level, I'll take you back so that you will get oriented back. See here, we're starting to go into the level of the maxillary teeth, and this is the central lateral canine 4, 5. I will go up. Now we're in the level of the molars. These are the crowns of the molars. We are beyond the level of the crowns of the molars. Buccal canal, palatal canal of the 4, 5, 6, and then I'm going here. See this shadow? This is the level of the tongue. It is not touching actually at the rugay area. So this is the level of the tongue. Still I'm having the atlas vertebrae, and you can see that the mandible still extend with the level, because you know that the mandible actually condyles, articulates above the maxillary or above the maxilla. I'm going up. See here that this tooth is root canal filled. Okay, this is the 6, and this is the other 6. I can see here a distobuccal, mesiobuccal, and the palatal canal. Let us see if this tooth has a MB2 canal. No MB2 canal that can be seen over here. Let me enlarge. I'll bring it closer. This is MB1. Actually, there is no MB2 over here. Another tooth which is root canal filled over here. You can see it that again it has no MB2. You can see now we've gone up. There is no tongue over here, and this is air which is present. This is the air which is present above the dorsum of the tongue and the maxilla. Okay, this is the air which is present in the dorsum of the tongue and the maxilla. Okay, and then we will start. This is the incisive foramen and the incisive canal. See how big it is. Now I'm going up. The maxilla started now to fill, to replace the air which is present, and we've gone now into the level of the maxillary sinuses on either side. See over here, this white line, this is the level of the maxillary sinus. So we're going into the level of the maxillary sinus over here. You can see that these are the apices of the roots. This is the canine, and this is the anterior nasal spine over here. We're seeing it from the top. Now I am in the maxillary sinuses. This is the left maxillary sinus. This is the right maxillary sinus. Left maxillary sinus does not appear to be clear. We will see afterwards. Now I'm going into the maxilla now. Okay, maxilla. The right maxillary sinus appears to be clear. I'm going up. Now this radio opacity you can see here is the nasal septum, and these two grayish radio opacities here, which apparently looks more of a soft tissue compared to the bone over here, this is the inferior concha. Now I'm going, this is the neck of the condyles, and this is the start of the condyle. This is the zygomatic process of the maxilla of the left side. On the right side it's not showing. I'm going up. You can see that the zygomatic process of the maxilla started to show over here, and the zygomatic arch as well started to appear. Now if I will see, this is the ala of the nose, and these are the nostrils. Okay, here there is no coverage because it is not covered in the X-ray, and the nasopharynx started to develop over here. These are the atlas vertebra. See, it goes up, it goes all the way up, and if you can see here on either side, these are the styloid process. Styloid process, sometimes it may go, see, this is one, this is the other one, it may go, now it has disappeared. I will go up, up. I'm going up. Now the sinuses started to appear in their maximum thickness. This is the meatus, and we are starting to have now the wall, the nasal wall or the nasal septum. I'm going up here. I'm going up. This is the maximum. This is the middle meatus, and this is the middle concha, and this is the meatus. See the deviation in the nasal septum. Now we're starting here to go into the middle cranial fossa. I'm going up. So this is the see, the sinuses started to get smaller and smaller, and we are now going into the ethmoidal sinuses, ethmoidal sinus, and then we are part in the sphenoid sinus, and the coverage just disappears. Okay, I'll go back again. See where we have gone now. This is the maximum that we can go to this level.